Hello, this is Dr. Evan Osar, co-founder of Massage Therapy Insider and author of the Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. Welcome to part 2 of Posture and Movement, improving the massage therapy experience for even greater client results, retention, and revenue. In part 1, you discovered that if you truly want to differentiate yourself in the marketplace, you must discover and implement the industry's best practice tools, techniques, and strategies to helping your clients achieve their health and fitness goals. Because if you offer your clients even greater value and help them improve their posture and movement, you provide them with the tools and strategies they need to accomplish their health and fitness goals. And when you are able to help them accomplish their health and fitness goals, you've empowered them to live the life to the fullest and you give them their lives back. They can do the things they want to and love to do. And when you're able to give them their life back, you have moved from being successful as a massage therapist to being significant, meaning you have made a dramatic difference in the lives of your clients. So we're going to look at posture, and in the next installment, we will visit movement as an extension of posture and what exactly good posture looks like. First, what is posture and why is it important to you as a massage therapist? Posture is a snapshot of an individual's stabilization and movement strategy. In other words, it is the position and strategy our nervous system has adapted to get us through life, to help us accomplish our goals, and to compensate for any surgeries, traumas, or pain we have encountered in our lives. What exactly is a strategy? By definition, a strategy is a high-level plan to achieve one or more goals under conditions of uncertainty. Our brain and nervous system creates a plan both while we are standing and while we are moving to achieve our functional goals, whether that is to stand in place, to raise our arm out to the side, or to run a marathon. Look at this individual's standing postural strategy. Note her head tilt to the right. Why does she adopt this position? Watch when she lifts her arm to the side. Notice the increased head tilt and shift to the right. That's why we say that posture is a snapshot of an individual's ability to control and move their body. The resting postural position is a reflection of their strategies, both their static strategy as well as their movement strategy. That is why it's so important to institute an appropriate self-care program, because simply releasing postural restrictions rarely makes a significant change in the brain's nervous system patterns or the strategies it uses. So, what does optimal posture look like? Well, let's look briefly at the thorax, meaning the thoracic spine and rib cage. Generally speaking, the thoracic spine and rib cage should be positioned over top the pelvis. It should be equal side to side, symmetrical side to side, and the head should be positioned directly over top the thorax. From the side, the thorax again should be positioned over top the pelvis. The rib cage should actually feed down into the pelvis, meaning that the lower ribs should sort of open up down towards the pelvis, and there should be a straight line from our head through our neck and lumbar spines and through our hip joints. So again, the head should be positioned over the thorax positioned over top the pelvis from the side. Oftentimes we are taught to look at posture and determine a client's postural strategy based off what we see. However, sometimes the eyes lie to us, so we actually have to palpate the thorax. We're going to look for a position on a plumb line, meaning like if you drop a straight line down or a plumb line from the ceiling, your client's thorax should be positioned optimally side to side on the plumb line. It should also look as if the client is standing on a clock, with one foot is on 3 o'clock and the other foot is on 9 o'clock, and the client is facing towards 12 o'clock. As you palpate their thorax, they should be positioned equally between both feet. Their weight should be equal between both feet, and the thorax should face forward. There should be no clockwise or counterclockwise rotation of that thorax relative to the pelvis. So again, we want to look at the thorax also and determine, do those lower ribs then feed down into the pelvis? Is the rib cage positioned nicely over top of the pelvis, or is the rib cage wide? Is it flared, meaning that those ribs are lifted up excessively in the front? Do they have thoracolumbar extension, where the thorax becomes the lumbar spine? Do they have increased extension? How is the tone of their lumbar erectors? Go by what you feel, then open your eyes and see if what you feel matches what you see. That's the key to performing an optimal postural assessment. We'll talk more about that in the next section as well. So, what is posture? Posture is a snapshot of an individual's postural and movement strategy. When our clients have a good postural and movement strategy, they can work towards achieving their health and fitness goals. Why is it important to feel rather than just observe posture? because our eyes lie to us, and at times they tell our hands what to feel for. Our hands tend to be much more accurate assessment tools than our eyes. So start with your hands and then confirm what you feel with your hands with your eyes. What should you feel for to know whether or not your client's trunk is in the correct position? You want to feel that the trunk is aligned and symmetrical and that it is positioned over top of the pelvis. The ribs should feed down into the pelvis. Again, they should have no rotation, no side bending, no hyperextensions. In the next part, part 3 of this 4-part series, we will look at how your client's postural and movement strategy is established and why knowing their strategy is important in directing both how you treat your client as well as what are the most appropriate self-care techniques you will need to share with your client. When your client is invested in their own health care and has strategies for improving their own posture and movement, you've empowered them to take control of their own health. And when we empower our clients to take control of their own health, we can facilitate a powerful change where the individual, not the doctor, pharmacist, or government, creates an optimal environment for the healthy individual, a healthy community, a healthy world. This is Dr. Evan Osler, the Massage Therapy Insider. I'll see you in part 3. Take care.